Good afternoon, everyone, and thank you for joining us as we give you an update on COVID-19 pandemic here in Erie County. Unfortunately, today, we have to report that we have 259 new positive cases of COVID-19, and sadly, 4 additional deaths. We have not had a number this high since December of 2020. It saddens and concerns me that we continue to see our cases remain so high despite having the tools to slow down the spread of COVID-19. Masks and testing are readily available, and most importantly, for most people, now vaccines are available. I cannot emphasize enough the importance of protecting yourself and protecting others. Only then will we be able to begin to see our way forward and out of the hold that COVID-19 has put on our children's education, on our economy, and on our everyday lives. As of yesterday, in Erie County, there were 74 people hospitalized due to COVID-19. 46 of those patients were in the ICU, and 13 were on ventilators. Over the last week, not counting the 4 additional today, we had 14 deaths reported in Erie County, and those deaths ranged in age from 40 to 94. 12 of those individuals were not vaccinated. 1 was partially vaccinated, and the last person was fully vaccinated, but also lived in a long-term care facility, which we know is a very vulnerable population. 2 of those 14 deaths occurred in people who were in their 40s, and which many people would consider sort of the prime of your life. All lives taken by COVID-19 are lives taken too soon. This is a premature death. We must take a proactive approach in order to prevent these deaths. All of us collectively need to work together to prevent these deaths. We have seen the positive effects of the COVID vaccine. The number of those who experience the most severe outcomes from COVID-19 are by far mostly people who remain unvaccinated. The good news is that the vaccine is available for those even down to 5 years of age. I'm cautiously optimistic now that this will help reduce the spread of this terrible virus in our schools and to the families of those students. We are all hopeful for a day when COVID-19 is no longer disrupting in-person learning for our children or causing great concern for all of us around holiday gatherings. To get to that point, again, we must work together. Everyone who is eligible should get vaccinated. While the spread in Erie County remains high, we should all be wearing a mask in public settings or when gathering with those who live outside of our home. Again, I implore you to please look at getting vaccinated. If not for your own protection, to protect those other people in your life that you love. Today, I am pleased that we are joined by Dr. Cynthia Weibel, the lead physician at Children's Community Pediatrics. Dr. Weibel will share information about the distribution of the pediatric COVID-19 vaccine. Dr. Weibel?
Hi. Yes, now that the vaccine has been approved for 5 to 11-year-olds, it will be available in pediatric offices as well as at UPMC Hammett, LECOM, and Allegheny Health Network is also distributing the vaccine. So there are many places that children can get the vaccine.
Thank you, Dr. Weibel. We're truly fortunate to have a safe, effective, and free vaccine finally available to our children so that many families we know have waited a long time for this. Now I'm going to introduce, of course, Melissa Line, who I think all of you know, the director of the Erie County Department of Health, to share an update with us. Melissa?
Thank you, County Executive. The vaccines are safe and were developed by experts And as you've heard, they're widely available in Erie County. A small percentage of boys may develop temporary myocarditis, which is an enlarging of the heart muscle. And this is temporary and will go away after some rest. And in fact, the risk is higher if young people are infected and getting long-term myocarditis from a COVID-19 infection. Therefore, the risk is higher when it comes to getting severe illness and hospitalization from COVID-19. I wanted to bring some data to this topic today. So national pediatric data from ages 5 to 11 since the onset of the pandemic in the United States. We have had 1.9 million cases in children 5 to 11. 8,300 of those children have been hospitalized, and we have had 94 deaths, and 2,316 of those have suffered from multi-system inflammatory syndrome. So it's important to know that while we know that many children have had very mild symptoms, or maybe no symptoms at all, and have still tested positive and can transmit the virus, there are a number of children that are still getting severely ill. So this is to urge you to consider getting your children vaccinated if they are ages 5 to 11. We had 79 children in Erie receive vaccine during the clinical trial, and we had 6 additional children not in the clinical trial receive vaccine that was reported on the 3rd and the 4th. We are now at November 10th. I don't have the pediatric vaccine reports yet. An interesting piece of data that I also wanted to share is the number of deaths that have occurred in other vaccine preventable diseases. So for hepatitis, for those under 20, from 1990 to 1995, there have been 3 reported deaths. For meningitis, between the ages of 11 and 18, from 2000 to 2004, we've had 8. Varicella, which is chickenpox, ages 5 to 9, from 1990 to 1994, there's been 16. And rotavirus, which is under the age of 5, from 1985 to 1991, there's been 20. And for COVID-19, from ages 5 to 11, in just 1 year, from October 2020 to October 2021, there's been 66. These are national statistics that have been provided to me from the National Association for City and County Health Officials webinar that was just presented earlier this week. So I want everyone to really take those statistics when you're making your decision on how severe the COVID-19 infection really is for children ages 5 to 11. Lastly, I'd like to remind everyone that if you are using an over-the-counter test or a home test, to please read the instructions thoroughly and ask a healthcare professional for advice or how to correctly use and report the test results if you're having any difficulty. Always check the expiration date before using. If you test positive, you should consult with a healthcare provider or professional, and the Erie County Department of Health can actually help with providing guidance on isolation and quarantine. Whether you test positive or negative, if you're not feeling well or you've not been in contact with someone, or if you've been in contact with someone that has COVID, please remember to take care of yourself and consult with a healthcare professional and stay home if you're sick to not infect others. County Executive, that's all I have for today, and I turn it back over to you.
Thank you, Melissa, and thanks again to the Erie County Department of Health employees who continue to do an outstanding job providing resources and information to help keep Erie County safe. I cannot thank you and each one of them enough for your continued hard work on this for so many months. I'm now going to turn it over to the media for questions. I do want you to know that Dr. Weibel will need to be leaving our broadcast here by 3:30. So if you have questions for Dr. Weibel, I ask that you consider asking those in your first round of questions. And so I'm going to start today with Joel at Talk Erie.
Thank you, County Executive. I actually have a question for Melissa Lyon. Melissa, just wondering if there's any anecdotal evidence regarding clusters and outbreaks that are having Erie County have kind of reverse a trend that the rest of the Commonwealth is having as far as new cases.
Thanks for the question, Joel. To be honest with you, what we're determining based on the case investigations that we're able to conduct is that friends and families are getting together and they're gathering and they're celebrating. We've seen things such as Halloween parties, birthday parties, bridal showers, baby showers, funerals, the types of things that as friends and family, you want to get together and you want to celebrate and acknowledge the good that's happening in one's life. But I can't stress enough the importance of considering to get a vaccination if you're eligible to do that. That allows you to do these gatherings more safely. As well, masks, they do work, especially when you're indoors. So if you have a large gathering and you want to get together, please consider masking, especially for those that are most vulnerable in your families, which would be those over 65 and those that are not eligible for vaccines, which are under the age of 5. And keep in mind, those that are 5 to 11, it's going to take some time for them to get vaccinated and be fully protected based on their immune response. So overall, Joel, we've been seeing it has a lot to do with gatherings, and many of them are taking place inside. And I do fear that as we move into more colder months and the holidays, we know Thanksgiving is approaching, as well as Christmas and New Year's, that we may continue to see more of this. Thank you, and I turn it back over to the county executive.
Just a quick follow-up, Melissa. Just is it safe to say then that that if all parties are vaccinated, it's still not a safe situation to have people from multiple families to come together for a bridal shower or a baby shower?
Thanks for the question, Joel. I mean, overall, if you have a fully vaccinated gathering, your risk of COVID-19 transmission decreases significantly. However, we do know that it's still respiratory virus. So, I mean, there are still lots of respiratory illnesses that are circulating. Influenza will be coming on soon. We have a few cases there. RSV has all been found in children. We've had a few hundred cases already. But what we're asking is to really consider the gathering and then consider the parameters that you have in place to be able to hold that gathering safely. We know that vaccinations are one of the tools that we have, as well as masks. We also know that we're in a high transmission. That's been very stable for many weeks. And it's the Delta variant, which is so much more transmissible. And with that being said, vaccines do a great job of preventing the spread of infection, but they're not 100%. They do decrease the need for the results of severe illness, which are hospitalizations and death as well. As you saw by the numbers, most all of the deaths that we've had have been unvaccinated, as well as those that have been hospitalized. We've had reports of 80% and 70% of those that are hospitalized are also unvaccinated. And as well as the age of the individuals, we've seen 40-year-olds, 50-year-olds, 60-year-olds. We're seeing younger people afflicted and in hospitalizations and deaths. So I can't stress enough the importance of vaccines for us to get back to our normal life. That's really my ultimate response. It's the way through this pandemic. We still have a long way to go in Erie County to hit a vaccine rate that's going to get us through this pandemic. Thanks, Joel. And I hand it back to the county executive.
Thank you. And now we'll turn to David at the Erie Times News.
Hi, Kathy. Thanks. My first question is for Dr. Weibel. Dr. Weibel, hope you're doing well. My question is, what kind of conversations have you had with the parents of your younger patients who are now eligible for the vaccine? And has there been a lot of hesitancy among the parents of, say, 5 to 8-year-olds or 5 to 10-year-olds about getting the vaccine? And what do you tell these parents?
Well, since the vaccine was authorized for the 5 to 11-year-olds, which is obviously very recently, we have had a lot of interest and a lot of excitement in parents who have been waiting for it. And we've had a big demand this week, particularly for the vaccine, which is great. There certainly is some vaccine hesitancy, and I think some parents have a wait and see approach, but I think overall, the parents I've talked to are very happy that a vaccine is available to help protect their children. So thank you for the question.
Oh, yeah, I just want to follow up, Dr. Weibel. The ones who are hesitant, what are some of the things that you say to them?
Well, I say that the vaccine, like Melissa said, is not 100%, but it is very effective at preventing severe disease, hospitalization, and death. And being vaccinated does allow you to do more activities that you would not otherwise be able to participate in, more like pre-COVID activities.
Thank you.
Thank you. We're going to turn now to Erie News Now. Anybody with us from Erie
Hi,
News?
can you hear me?
Yes, I can hear you now. Jameson? Go ahead. Can't hear you. I'm going to go to WJET and we'll come back to Erie News Now. Jet TV?
Hi, it's Chelsea. Medical experts from local hospitals are saying that the daily case numbers are higher right now than they were this time last year. That being said, the state Supreme Court is throwing out the governor's school mask mandate. Is that a concern for children and parents of those children who are potentially unvaccinated?
I'm going to ask Dr. Weibel if she'd like to comment on that first, and then Melissa Lyon.
Yes, I think it's a concern. Until a big proportion of school-age children are vaccinated, I think masks should be used to help protect them. I hadn't heard that was here already. I heard that there's talk about after the vaccine that mask mandates may be relaxed.
Yeah, that was just announced earlier, just a little bit earlier today. And I think we'll wait and see if the governor and his team are going to appeal that, which I would expect that they would, because he had put January 17th, I believe, as the date that he was going to lift the mask mandate for school, which again, as Dr. Weibel indicated, would give 2 months of time for many children to get vaccinated. And as she mentioned, the demand is high right now, the first week, and it's going to be hard, to get all those children through. So we'll wait and see what the Wolf administration does. But I think we all have great concern that tomorrow schools may decide that they're not going to require masks, and then we're going to see even higher numbers than we have today. I'm going to see if Erie News Now, are you with us?
I am with you. Sorry about that. I was having a little issue with my phone.
I understand.
I also had a question just about the court making this decision today. Do you feel like this was a smart decision to make, especially right before the holiday season?
Well, personally, I would say no, because of all the things we've been talking about. And not only do we know that masks prevent the spread of COVID-19, but it prevents the spread of colds and flus and other viruses that children tend to pick up very easily. Last year, I think we all were remarked on how healthy everyone was, because we were all masked and we were kind of preventing the spread of so many of those airborne illnesses. But I think that we have to wait and see what the Wolf administration decides to do, since this is very kind of breaking news at this moment, but it is a big concern. And I'm sure there'll be a lot of parents who will continue to mask their children because of that concern. I don't know, Melissa, do you want to say anything further on that?
Thanks, County Executive. I think the only thing I would add to what you've added, what you've stated, is it is breaking news. We'll have to wait and see. But we can continue to support school districts, superintendents on their decision making, if they need access to data, if they need to navigate guidance, recommendations, assistance with communication with parents. We've always been there for them, and we will continue to do so. Thank you.
Thank you, Director Lyon. And I would just like to add one more thing. We actually have a mask mandate on for schools in Erie County, and right now that's still in effect. So that we'll see what happens. But again, we're gonna see how this plays out with the courts and with the Wolf administration, and we'll try to stay aligned with the state as they move forward. We're going to go back to Joel at Talk Erie.
Thank you, County Executive. This one is for you. As a part of a business family, do these vaccine mandates and the new OSHA rules that are coming out nationally, even if they are being challenged in the courts, don't they exasperate the trouble businesses are having in keeping fully staffed? What's your opinion on all that?
Well, it could very much make things more difficult. I've certainly talked with a lot of business owners about that. Again, I understand the spirit behind the rulings. It's very difficult. We're in this very difficult, unbelievable culture war around vaccinations and masks, and yet we all know that these things prevent deaths, as Melissa mentioned, so many other diseases where people get vaccinated and children have to be vaccinated in order to go to school, and it's preventing so many deaths from so many diseases. So it is exasperating on so many aspects, Joel. Again, it's hard to believe, 21 months into this, that we are at this point when other countries are clamoring for more vaccine for their people. So it's a difficult moment.
Thanks.
Mm-hmm. Erie Times News, David?
Yes, Kathy, this one's for you. So a year ago, we were right on the cusp of that first initial surge that caused so many cases and took so many lives. We were averaging, 40, 50 cases a day. And, looking back through some of the stories we ran, there was limits. You were asking for limits on Thanksgiving gatherings. The governor halted alcohol sales for Thanksgiving Eve. There were a lot of mitigation measures around. This year, with a lot more cases, especially those reported today, we really hardly have any mitigation requirements. How do you feel about that? And do you feel like your hands are tied because either a lack of public appetite or because of rulings from the state? Or do you feel that we're in a different place even with all these cases because of the vaccine?
I actually feel we're in a very different moment in time. We have tools now. We were struggling to get masks, if you can remember, back in the early days of this pandemic. In fact, there wasn't enough masks for healthcare workers, so they told everyone else not to wear masks because of that. Now you can find masks everywhere. That's a huge tool that we all have access to. Testing. Testing wasn't hardly available in the beginning, and for a long time we really struggled. Now there's testing available, so that's another tool. And of course, the biggest tool and the most effective tool is the vaccine, and that is available to all of us, free of cost, very easily accessible. So we have the tools. I'm going to equate this to smoking. We have done a lot around smoking over many years to mitigate the devastation that smoke has on people's health. So we took it out of restaurants. We've taken it out of public places. We've put warning labels on the cigarettes. Cigarettes are not supposed to be purchased by anybody unless you're 21. So we've tried to do what we can, but many, many people still smoke. They've decided that it's worth the risk, and they're willing to do that. But at this point in time, we have the tools to stop the spread of this. We have the tools to protect ourselves and our loved ones from the devastation, not only of getting COVID now, but the long-term consequences of the damage that causes to your body. And people are making choices. But for those of us who are vaccinated, I feel much better getting together with family and friends and being together and trying to live sort of a normal life when I know that all those people I'm with are vaccinated. And now I'm going to feel even better knowing that many of my grandchildren will be able to be vaccinated, because I only had 2 that were 12 and up, and so they are vaccinated, but now the other younger ones that are older, 5 and up, will be able to get them too. So it's really at that moment in time where people have to make a choice for themselves and their families and their friends, and unfortunately, for many of them, they will unfortunately be saying goodbye to some people that they love, and that is the reality of the situation we're in right now.
Is there anything that you feel you can do as county executive or overseeing the health department that you can do above and beyond, right now at this point, basically begging people to get the vaccine, begging them to wear masks? Is there really anything else that can be done?
We have tried so many different things. The incentive has worked well in county government. We have 73% of our employees vaccinated, and we also have a mask mandate on within county government. So if you are in the county buildings, you have to have a mask on unless you are in an office by yourself, completely isolated from your fellow employees. So when I leave my office to go get a cup of tea, I throw my mask on as I walk out into the hall. I may or may not run into anybody out there, but that is what we do in county government. And with that, we've actually kept our cases extremely low, and the few people that have it have really, acquired that virus from someone else outside of work. So that's what we're doing from a work standpoint in county government. That's what I think a lot of other places are trying to do, and by giving incentives to people and having them be masked, and it's working in schools too. I mean, the problems with schools is mostly what's happened outside of the school time. Schools have done a great job within the classrooms and are working really hard on the other activities of trying to keep the virus from spreading. So again, I think it's really going to be more of an issue, as we already said, if they don't wear masks in school, and that's up to the school district to decide. It puts a lot of pressure on that school district, and it puts a lot of pressure on the parents and the children who will decide to wear masks. But we are at that moment in time. I don't know what else the county government can do at this point. We can certainly do mandates, but as we've talked before, we don't really have a huge enforcement team. How do we go out and make sure that people are wearing masks in many, many places? I think it's really up to the business at this point.
Thank you.
Sure. Erie News Now. We'll go back to Jameson.
Okay, sure. This one's for Dr. Lyons. Is there an adequate supply of vaccines for children in Erie County, and are any mobile clinics planned for children?
Yeah, thank you for the question. To my knowledge, there is adequate vaccine available for children 5 to 11. There was federal, what they call pre-positioning of vaccine through the federal pharmacy program. I think there was also some pre-positioning to healthcare providers. I know that locally there have received doses, and then ordering will be available, is available now as well in quantities of 100 doses, which will help some of those smaller practices. And for example, the health department will be ordering the 100 dose. So it's widely available. To answer what's kind of happening within the vaccines availability, in particular, the health systems are working to provide clinics with the school districts that would like those. So LECOM, I do have to give them a shout out. They've been working very closely with the school districts to set up dates and times that work for them to have clinics available in their communities. And as far as mobile, we will likely have mobile clinics available, but they're not scheduled at this time. We have to determine, will we be offering, what age groups, all age groups? Are we offering boosters as well? In particular, it becomes a little bit of a logistical challenge because the doses are different and you're having different vials. So how do we streamline that process in a way that's effective, efficient, and beneficial to the community? Thank you for the question. Back to you, County Executive.
Thank you.
I just have one quick follow-up. There's a lot of numbers thrown out there. I don't know if you had a specific number as how many children 5 to 11 have actually been vaccinated in Erie County.
Yeah, so I reported out, and the number is it's fairly low right now. I think there's a lag in what we call our SIS state immunization system. So as of the 3rd and the 4th of November, we had 6 reported vaccinations in children 5 to 11. We have 85 total vaccinated in Erie County, but 79 of them received the vaccine during the clinical trial period, which was before November 3rd. So I anticipate having better data come early next week.
Got you. Thank you very much.
Thank you. We'll go now to Chelsea at Jet TV.
Hi, as you mentioned, we have the tools, masks, and vaccinations enough to vaccinate people in Erie County. What is it going to take for Erie County to get back to normal?
What it's going to take is a high vaccination rate, much higher than we're at. I don't know exactly how we achieve that. We'll be very interested to see what happens once we get more children vaccinated, because we do know that there's a fair amount of spread that's been happening within children, and then they pass it on to their parents, maybe their grandparents, and the more vulnerable populations, the older people. in our community. So it will be interesting to watch as we get more children vaccinated if we start to see some of the decline in these numbers. It's always important to remember children are very active and love to be together and love to do lots of activities, whether it be sports or band or, just play together. And so getting more children vaccinated, especially as we're going back inside. Today's a beautiful day, but by the weekend, it's maybe almost going to be snowing. That's really, really crucial. So I think we've just got to wait and see how those numbers go with the children. But it's going to take for many more people to decide enough is enough. I'm going to go get vaccinated to protect myself, my loved ones, in this community as a whole.
And really quick, just one follow-up. What is the youngest person in Erie County to die of COVID?
Melissa Lyon may know. I believe it was the 24-year-old county employee, but I'm not sure if there's anyone younger than him. Melissa, do you know?
Thank you, County Executive. We do not have any pediatric deaths in Erie County, and I do not have at my fingertips the youngest person that has passed away. County Executive, you could be correct on that county employee. Thank you.
Thank you.
Sure. We'll go back to Joel for last question.
Yes, one more quick one for Director Lyon. Melissa, just quickly, do you have any sense that Erie County is getting its adequate supply of monoclonal antibodies? And what are your thoughts about the upcoming other therapeutics like the Merck pill, the Pfizer pill that are the antivirals that are coming up?
Thanks, Joel. I don't know that I'm best to answer your question about the monoclonal antibodies. I would really default to my colleagues in the healthcare systems. From what I understand, the availability is there. But when you ask about fair share, I don't think that I have a good handle to be able to answer that question. But to talk about the additional therapeutics that are becoming available to treat infection when you become hospitalized or pre-hospitalized, just as we would have therapeutics for other infectious diseases, it's really encouraging because we know while we call this, it is now a vaccine preventable disease, that will be the category that it falls into for us as public health practitioners. We always know that we need treatments for those that may actually become infected or if we have breakthrough cases of those that are vaccinated. So it's really encouraging. I think we'll continue to see more products on the market that will be effective in treating infections moving forward. So the more tools that we can throw at this infection, this infectious disease, the better we'll be in the long term. But this takes time. It takes time to get those products to the market. They have to go through clinical trials. They have to go through a lot of rigorous standards, quality, efficacy, and so it takes time. But it's encouraging. Thanks, Joel.
Thank you.
We'll go back now to David at the Erie Times News.
Thank you, Kathy. If you can, I know you said it's kind of wait and see as far as what the county's mask mandate is for schools, but if you can just elaborate a little bit on it. If the governor doesn't fight this, will the counties automatically go away? Can you tell me what you do know about what the status of the county's mandate for masks at schools would be if the state's one goes away?
Well, the county's mandate would not automatically go away, I don't believe. Again, I need my solicitor to really look and see what the courts are saying. I'm not a lawyer, and so we need to look at that. But our mask mandate is not tied directly to the states. But we're trying to align with the state, and we were already looking at that in terms of the January 17th lifting of the mask mandate. So again, tomorrow's Veterans Day, so there's no county government open. But on Friday, we'll be looking closely at what's happening on the court side and then making some decisions from a county level.
And then just to follow up, either you or Melissa on this one, if it then goes to each school district, have there been discussions at all with any of the school superintendents or any other officials from the school districts about how they proceed from this point on?
Well, Melissa has conversations with the school districts, so I'll turn it over to her to see if she's had any of those.
Thanks, County Executive, and thank you, David, for the question. We do have routine meetings with school district leadership, usually weekly. And unfortunately, we've not talked about this. It's been sort of breaking as of yesterday and today. So I don't have a sense for how school districts will navigate this moving forward. Interesting, I'd like to add that because school districts will be able to technically after January 17th, make the decision whether they will require masks throughout their school district or buildings. From a public health disease prevention strategy, isolation and quarantine will still be in effect. Meaning if you're positive, you're gonna have to go through your isolation period and you won't be able to interact as normal. And then the close contacts are still going to be required to quarantine. This is continued to be public health practice for all infectious diseases. In order to come out of quarantine, let's say early, as we've allowed with a test result indicating that you're negative and you have no symptoms, you have to mask for the continuous 14-day period. So it's going to get pretty messy when we have students that are close contacts or testing out of quarantine are going to need to mask through the 14 days in order to engage in their activities at the school district. So thank you for that opportunity to allow me to share that.
Thank you, Director
Thank you.
Lyon. Okay, thanks. And we'll go back now to Jameson at Erie News Now.
Okay, I know the surge of cases have been putting a strain on a lot of the hospitals, specifically with their beds. Are you looking at any ways to provide extra space, say if there's a even larger surge in cases?
Well, when we had the hospital systems on a couple weeks ago, what we were told by the hospital systems is it's not a matter of space, it's a matter of staffing, that they have the space that they can increase for the number of beds, but as so many are struggling with staffing of nurses and therapists, different specialties within the medical field, that's where the problem will lie, is how do we staff up? As I think it was Dr. Muccio who said, a hospital bed without staff is like a hotel bed, and it doesn't really do any good to a patient who needs care. So that's the issue, I think, for our medical facilities.
Thank you.
And we'll finish up with Chelsea at Jet TV.
Yeah, I guess on that note, in terms of staffing at local hospitals, are there any kind of initiatives to make sure that they don't run into issues where other patients aren't being seen because of this increase of COVID patients being hospitalized?
Those questions really would have to be given to those specific facilities about how they're handling that. I think we're really blessed in Erie County to have some wonderful hospitals and people who are doing their best to try to take care of everyone who comes through the door. But it has always been our concern as these numbers go up in terms of the hospitalizations. Well, the numbers in the community go up, and then eventually the hospital numbers go up, and then of course the death numbers go up from there. But I think all of us should think about that when we think about, do we want to get vaccinated or not? Do we want to be that person who shows up at the hospital and maybe the care is there, but maybe not quite as intense or as you might need because there isn't staffing? And that has happened across this country. I'm not saying it's happening here, but we've seen it across the country. And that is a frightening scenario to think about. So again, another reason for all of us, for our community's sake, to get a vaccine. So thank you for being again with us, different media. We appreciate that. I want to thank Dr. Weibel for joining us today. But before we go, I want to just share a couple things. We do have business grants available now through the Erie County Redevelopment Authority. This is money that came through the American Rescue Plan, and these grants are open right now. The first grant is a new small business grant. This is for businesses that were established after January 1st, 2020, because so much of the money that came in initially, you had to have been established before the pandemic hit. So these are for new businesses that just started and are struggling. The second grant is the local Shuttered Venues Grant, designed to offset the losses incurred by so many of our recreational and those related industries who also were not eligible for the other COVID relief programs. So information and applications on that can be found at the Erie County Redevelopment's website. And again, they are open currently. I'd like to mention a star business, Shawarma King on West 26th Street, which opened their doors just last month. They're working to keep our community safe by wearing masks, encouraging all their patrons to wear masks as well. They have hand sanitizer available and are following a strict sanitation procedure to keep all their surfaces clean. Thank you to the staff at Shawarma King for doing their part to help keep people safe, and thank you to all of our restaurants. I know many of you are working very diligently to keep our community safe while you continue to serve us. And before I close, I want to extend a sincere thank you, heartfelt thank you to our veterans. Tomorrow being Veterans Day, I hope that you recognize the veterans in your life, the veterans you may see out, not just tomorrow, but on every day for the sacrifices they have made to uphold the principles that our country stands for and that so many have fought for and many have even died for. So in closing, I ask you to please keep yourselves safe, your loved ones, especially those who can't be vaccinated. I encourage you to get a vaccination if you haven't, to wear your mask when indoors with others that you do not live with. And of course, if you're feeling ill at all, please stay home. If you have the symptoms, go get a COVID test and then resume your life if you resume your normal activities if you do not. That's really key. So many people we hear fell a little sick, they go out, they get around people, they actually have COVID and they're spreading it. So think about that. If you feel even a little bit of symptoms, just do the right thing. Stay home, get tested, and then if you don't have it, you can get right back at it. In the meantime, stay safe, and we'll see you in 2 weeks.